So good afternoon, everyone, and thank you for making the time. My name is Leo FLOR, and I'm the director of King County's Department of Community and Human Services. And this is a press availability and summary of the release and top-level results from the 2020 point-in-time count. I'm joined as a co-presenter by CHRISTINA MCHUGH, who works in our performance measurement and evaluation unit within the Department of Community and Human Services, and CHRISTINA is going to spend some time after my introduction highlighting the data dashboards that present a lot of the information that we think is really important to compare and to merge with what is contained within the point-in-time count. First, just a really quick introduction on what the point-in-time count is and what it is not. So the point-in-time count is a federally required count. It must happen at least every other year. In King County, we do it every year traditionally. And it requires something called a continuum of care. And the Department of Housing and Urban Development defines continua of care across the nation. In some cases, they can be multiple counties that make up one continuum of care. But in our case, King County is our continuum of care, so the two are coterminous. What the point-in-time count does is asks a number of volunteers to come together on a single night in the winter every year, and then to go out and to perform a count. And so we have volunteers who come together, learn a little bit about the counting methodology, and then go out across the county, attempting to cover every zip code. And then they perform a physical count of people that they see who appear to be experiencing homelessness, and then come back with that tally. The count does count individual people as opposed to households, which some of our other data systems emphasize. And again, it is a one-night count. In addition to being that count, it's also a really important time that our community comes together and works together to both recognize the fact that homelessness continues to be a crisis in our community, and it is a time for community members to go out and bear witness to what it looks like to actually experience homelessness in King County. Just the highlight, the top level finding of the point-in-time count is that the overall number of persons experiencing homelessness in King County, the count estimates that has increased by 5%. And so that is an increase from 11,199 persons who were counted in the 2019 report, and that has increased in the 2020 report to 11,751 persons. Within that data, there are a couple of trends that we see in both directions. But before I speak in detail about that, I mentioned our data dashboards. While the point-in-time count does remain and will continue to be a really important event, an opportunity for us as a community to come together and remember and mark the solemnity of the crisis that we have of homelessness in our community. We also have other data collection methods that we can both collect more consistent data from, and that we believe offer higher quality looks into at least particular parts of our homelessness system. And so we do operate something called the Homeless Management Information System. And that is a data system that receives inputs from continuum of care funded providers from across the county. And the data that they put into that system on a monthly or quarterly basis feeds a set of dashboards that CHRISTINA will follow up and preview for all of you here. And we think one of the important things in consuming any of the information that's in the point-in-time count is that ability to look at what the count indicates year over year, but also the ability to compare that data with what we see in homeless management information system. And we have the highest confidence when the two data sources echo each other or indicate the same things. And then we have the highest confidence when we get year over year performance that indicates the same type of trend. When we have single year numbers that are different than what we have seen before, or when we see the two databases indicating different things, it's not to say that something is true or false, but it is absolutely an indicator for us that we need to take a closer look and begin to understand what is going on there. So With that preface, two places where we do have strong data correlation over multiple years now and between the systems. One is veterans homelessness. So we now have 3 consecutive years of decreases in veterans homelessness, and we see that there is at least not inconsistency between the point in time count and the homeless management information system driven dashboards. The second is with youth homelessness. So that is another place where we have 3 years now of consecutive reductions in overall numbers. And we see that there is no inconsistency with the other data systems. And so those are 2 places where we believe the data shows something that makes sense in the context of the fact that in both of those cases, those are populations that enjoy broad support from the community in terms of resolving their homelessness. Those are places where we as a community invest at all levels of government. So at the federal, state, and local level, we have significant investments in providing housing and supportive services to persons in both the veteran and youth populations. And so it also makes sense to us that we would see the commensurate reductions there. 2 places where we had data this year that indicate increases. So one place where we see that is in the number of persons that the point in time count identifies as chronically homeless. Another place is where the point in time count identifies an increase in persons experiencing domestic violence or gender-based violence, and a slight increase in homelessness there. And then also with unaccompanied minors, that is another place where we see increase in homelessness, and then finally family homelessness. And so those are areas where, because the data is different than it's been trending, we're going to be taking a look and seeing what the other data systems continue to indicate. And that really is a flag for us to take a deeper look at what's going on. I think the last 2 things that I'd like to mention. First, I mentioned that this happened in the winter of 2020. So the point in time count this year was at the end of January. And as we know, that was about a month before our community really began to experience this ongoing COVID-19 emergency. So we do not have, from the point in time data, an indication of what the effect of the COVID emergency has been. But we have every reason to believe that more people are either experiencing homelessness or at risk of experiencing homelessness, as the COVID-19 emergency has really presented these dual public health and economic crises that we know are challenging the ability of people who are already cost burdened as renters or who are already experiencing intermittent homelessness. The other thing that we really see here is across all years, across multiple data systems, and then as we see as in expressions in our community, we continue to see the effects of structural racism showing up across all human services systems and health systems. That is certainly still the case amongst the homelessness serving system, and we see both in the point in time count and in the homeless management information system, and in the the social services that we provide more broadly across the county and the region. That racial disproportionality continues to show up in a really persistent and painful way. That has been the case for multiple years again, and 2 groups in particular continue to see particularly disproportionate experience, and that is county residents who identify as Black or African American and Indigenous members of our community, both really exhibiting shockingly high disproportionalities across multiple years of data. So that is what I'll finish up with by way of summary. Again, the overall number has increased from the low at the 11,000s into 11,759. And for context, that number is within a range over the last 4 years where, if we take a look at the last 4 years of point in time data, the low point of the count has been at about 11,100, and then the high point of the count has been at about 12,100 plus. And so there's about 1,000 person range that the numbers in the point in time count have stayed within over the last 4 years and have fluctuated within that band. So that's what I have for initial introduction, and then I'll ask Christina to show what the data dashboards provide and really present an opportunity for anybody who's really interested in understanding the data to really get in there and take a look at what we're able to demonstrate.
Great, thank you, Leo. Hopefully you all are able to see my screen. Just to echo Leo's remarks, there is no one data source that can reflect the full scope and scale of homelessness in our region with complete accuracy. And so we find it's helpful to examine data across time, as well as across data sources to confirm the trends that we're seeing. So to that end, we are increasingly relying upon the Homeless Management Information System data, or HMIS. And last year, as many of you may know, we debuted our new homeless response system dashboards, which integrated a new methodology to track inflow and outflow from the system, or entries and exits, to use different terminology. And this has been a tremendous resource to the system and to the community. Since debuting those new dashboards, we've heard lots of feedback from folks who've been using it in the community about things that they like about it, things they'd like us to add to it. And so in response, we have added some new dashboards this year, included more data to try to build upon our understanding of the system and homelessness within King County. Just to kind of provide a quick overview, some of the enhancements that you'll find on the new dashboards are more data on how the system has evolved across time and trends over time in the numbers, a greater emphasis on racial equity analysis throughout, and related some additional looks at data by demographic categories and subpopulations. So I'm going to give a quick demonstration of what is new for 2020. But of course, there's a lot here that you won't be able to get to, so we invite you to explore on your own. So first, what's new? There's a new location. So you will find our dashboards at regionalhomelesssystem.org. Hopefully you're seeing this on your screens. The data is located at this tab at the top. So if you hover over regional homelessness data, you'll see a number of different pages that each contain various dashboards. First, I'll point out the point in time count page, which is where you can find a link to the latest Count Us In report and the news release here. And then switching over to the overview page. Here we have some highlight dashboards where you can see the latest number of households experiencing homelessness who are receiving services within the homeless response system. And so the data, it does operate on a bit of a lag because we have to wait for providers to report it in. So this is data as of March 31st, 2020. And so you'll see a number of different mini dashboards that show characteristics of this group. So I won't get too into that here. If you go over to the What is the Need tab, this is where you'll find a quick summary of inflow and outflow for the previous years. And so you'll see in 2019, there was a slight dip in the number of entries and exits into the system. But the proportion of the exits that represent exits to permanent housing has remained fairly steady in the last year. And if you visit the system flow dashboard page, which is under crisis response, we've added some new looks there, so you can look at data on entries and exits going back to 2016. And you can also filter the data by subpopulations, including veterans, seniors, families, youth, and adults. If we look at the How is Homelessness Changing Over Time tab, here's where we compare and contrast what we see in HMIS against what we see in the point in time count over time. So here we wanted to help folks to kind of understand the differences between the two data sources and the methodologies. So you can read a bit more about that here. And you can see that over time, the homeless response system has been serving more and more households. Just to reiterate, the HMIS data is in terms of households, whereas the point in time count is in terms of individuals. And in 2020, at fairly comparable points in time, we had more households receiving services in the system than we counted individuals in the point in time count. And then from there, I wanted to highlight household served tab, because I think this is an important one for helping to better understand and contextualize the findings of the point in time count. So this page will show several different dashboards that allow you to explore the number of households active within the system per month across time, going back to 2016. So you can, here we're looking at the entire system, so that's what this blue line at the top represents. The shaded areas underneath are showing the proportion that are sheltered or unsheltered. And we've added a drop-down tab here where you can filter by subpopulation, so you can look at veterans, seniors, adults, families, and youth and young adults. So just to highlight one, we can look at the youth and young adult breakdown. And I know there's a bit of fluctuation here from month to month, but you can see that over the past year, the number of youth and young adult households receiving services in the homeless response system has gone down, which mirrors the findings of the point in time count. So as Leo mentioned, when we see congruence between these two data sets, we have stronger confidence in the results. And we welcome you to use the filters and take a look at the other subpopulations as well. If you hover over to the population trends, you can get even deeper into the data. You can look at data by age group, household composition, race and ethnicity, and veteran status. So if you click one, it'll show you data across time for that subgroup. And then I'm going to quickly switch back over to the overview page to highlight some of the data on race and ethnicity that we've included this year. So these are highlights again and represent types of data that you can find throughout the website. So each of the pages has an ability to filter and look more deeply at trends by race and ethnicity, but these are just a couple of highlights that we wanted to show on the overview page. So on the first tab here, you can see that the breakdown of the number of households seeking services in the system by race and ethnicity mirrors the findings of the point in time count and demonstrates that homelessness is disproportionately experienced by people of color, and specifically Black or African American households and American Indian or Alaska Native households. The next two tabs allow you to take a look at entries and exits to the system by race and ethnicity. So we invite you to look more into this data. So that's exits and entries. And we've also added some data this year to allow users to examine system performance by race and ethnicity. So here we're highlighting return rates and exits to permanent housing across race and ethnicity groups. So I'm going to pause there because we are running low on time, but I just wanted to thank you for following along with the demonstration. We're really excited to be able to offer these resources and hope they continue to be useful to the community and the system going forward. There's a lot to see here. We invite you to explore on your own, and we welcome any questions that you have.
Hey, Scott Greenstone from the Seattle Times here. Are we good putting out questions now? Is that
yes,
fine?
Scott.
Go
Yes, go.
Okay, thanks. So March is the latest time that we have HMIS numbers for. We don't have them for April or May or June. I thought usually HMIS is updated a little bit sooner.
Yes, so our usual monthly update will happen in the next 10 days or so. So we are just before our next update where we would bring this up to April. And I would say that the data exists. It is constantly being entered in real time by providers. But when we publicize the data, we want to make sure that it's accurate and allow time for 100% of providers to report in. So we typically operate on about a 2-month lag. So this data will be up to date as of end of April soon.
Next question. Anyone?
I'll go again. As far as families go, do you think that the really precipitous rise is due to the extension or the expansion of I know that last year, or in the last year and a half, Mary's Place has opened up several family shelters. And I know the counting is a little bit better when it's in shelters. Could we point to that? I guess, Leo, this is a question for you.
Yeah, thanks, Scott. I think what you're doing with the question is exactly what we recommend, which is the point in time count. It is both the physical count of persons experiencing unsheltered homelessness, and then as you're referencing, for folks who are experiencing sheltered homelessness, we actually pulled the homeless management information system data, and then we merged the two together to get an overall count. And so it is true that when we have more family shelters that are open, to the extent that HMIS is a more dependable data source, and HMIS becomes a higher percentage of overall folks, that we would expect to see that number rise. I don't want to state that to mute the effect that regardless of what we were seeing in January of this year, we do expect that the COVID emergency is going to fall particularly hard on a number of types of household that are especially vulnerable. And we know that that is the case for families who are often having to make single salaries really expand and support larger household sizes. And so we do expect that, despite the fact that there is increased shelter availability for families, which is absolutely true, that one of the groups that we're really looking at, and what this data asks us to look at, is to make sure that we understand how moving forward families are experiencing homelessness, and then to see what types of interventions that we can make there. And one example of that is the Mary's Place shelter that was opened up in partnership with Amazon. Another example of that is an addition of resources that the King County Council has recently passed in a COVID supplemental budget to provide additional sources to Mary's Place as well.
Hi, it's Erica Barnett. Can you hear me?
Hi, Erica.
Hi, a couple of quick questions, and I'm still digging through these numbers. It's been kind of a busy day on the news front. Can you speak at all to the increase in psychiatric conditions? That jumped out at me in the health indicators. And also just the discrepancy, and maybe you addressed this before, I apologize, between, or the apparent increase in the number of chronically homeless people. It seems like that, is a number that should stay somewhat the same from year to year. So those two data points.
Thanks, Erica. Both of those being inside of the point in time count, and as you're pointing out, the data are behaving a little bit erratically there. So I think the first is those two do seem like they would be correlated with each other. So the fact that they have both increased, I think, says something to us. We do understand that the rate of incidence of behavioral health conditions is going to be higher generally amongst persons who are experiencing chronic homelessness. I don't think there's a one-to-one correlation there, but there is a correlation there that we see in the data. But those jumps are both larger than we would have expected, and we don't really have a comparable data point inside of HMIS to make the comparison against. So part of this is what are those data doing over time, and then the other place that we look is in our behavioral health databases. Another part of the system that King County Department of Community and Human Services oversees is the Medicaid-funded behavioral health system. The data do not say this, but I think what we are certainly looking at holistically as a community is the more time that we have large populations of persons experiencing homelessness, we would expect that as that chronic group of persons experiencing homelessness increases, that it is just the duration of homelessness that in and of itself can cause a person to become chronically homelessness, as homelessness is really tough on people's health, really tough on people's ability to maintain healthy relationships. Certainly by definition is hard to help people maintain their housing status. The other thing that I think we conclude from those numbers and actions that we've been taking recently is, as you know, Erica, one of the steps that we've taken in the COVID emergency has been to take the DESC main shelter and support them to move those same residents to a hotel-based setting in the city of Renton right now. And among DESC's clients, at the main shelter were a number of persons who were experiencing really severe chronic homelessness and a number of persons who were experiencing severe behavioral health and psychiatric conditions. And the experience that we're seeing of that same client group, once they're in a hotel setting, once they're able to sleep, they have consistent access to nutrition, they have the ability to feel safe and secure and feel dignity in that setting. We're really seeing that in and of itself is causing a transformation. So I think to recharacterize that, sleeping in a bed in a place where you feel safe, where you have access to hygiene and nutrition, appears to be really good for people's health and their behavioral health. And the absence of those things really appears to be bad for people's health and behavioral health.
Hi, Paige Browning with KUOW here. A question for Leo or I guess anyone else who wants to answer. We see a decline again in homelessness among youth and veterans. And you said that that's partly attributed to there being resources and money put toward that. That's good news. But I'm wondering, what do those resources look like for the Indigenous community and the African American community, where we see just hugely disproportionate numbers of people who are homeless?
Thank you, Paige. I think the linkage you're making is the exact linkage that we are taking a look at, where we see groups of people and populations that systems have operated upon in ways that make it so that they are disproportionately experiencing homelessness. The way to begin to fix that is to focus on the provision of resources to those populations. And so in the veteran context, at the federal level, there's a specialized set of federal supports from the Department of Veterans Affairs. We call them VASH vouchers. We have the local Veteran Seniors and Human Services levy, which is the largest levy of its type that we know about, that takes local funding and specifically at county level allocates it to support housing stability and supportive services for veterans. We have similar structures, although not as robust on a per capita basis for youth. And so I think when we now take a look at and recognize these persistent, painful inequities amongst the Black African American community and the Native community, the Indigenous community, I think we can see what it would take to begin to move those numbers down, and not make it numbers. I mean, these are humans, these are our neighbors, these are our relatives. And so we have at King County recently had good but small scale success working with the Chief Seattle Club on a bridge housing project called Eagle Village. That is an example of the type of focused resource that is designed to get at a part of the overall homeless population that the system has not traditionally served well. And I think that is really an example of what we'll be looking to find more opportunities to do going forward. Identify the reasons why the system doesn't work for a particular group of people, and then design interventions and resource them consistently in ways that get at those particular reasons why it doesn't work well, and to do it in partnership with a service provider in the community who is of the population we are hoping to serve and who has a relationship with the population we're hoping to serve. And we certainly see that that's the case with the Chief Seattle Club.
If nobody's going to jump in, I have another question about the numbers. The number of people experiencing homelessness for the first time increased, which suggests that not only are the numbers going up, but the number, but more people are just becoming homeless. It's not chronic and it's not repetitive. What does that say to you? Either you probably don't want to speak to policy questions, but what do you get out of those numbers when you see them?
It makes me, thank you, Erica. What those numbers really make me look at is the fact that we also know that we have very high and increasing numbers of persons who are rent burdened across the entire county. So this is persons who spend at least 30% of their household income on rent. And then there's another category of extremely rent burdened persons who spend at least 50% of their household income on rent. Those numbers are very high in our community. That's because we have, really high housing prices generally. And so I don't think it's a mistake that we would consistently have that rate of housing or rent burden. And then we would also have a lot of people who are coming into first-time homelessness. Another sort of factor that we're taking a look at and we're well aware of is that during the COVID emergency that we're currently within, we have a number of households And we believe many of them are within that rent burden category, although we don't yet have the data on that specifically, who are maintaining their housing right now because of assistance, financial assistance, and then policy choices that have been put in place at multiple levels of government to suspend evictions. But we are very conscious and aware of the fact that if that financial support were to cease before the access to income recovers, or if we have policy changes, that we would expect to see additional people moving from that rent burden but housed category into first time or newly homeless category. And so a lot of that is inference, and the data don't yet show that, but I think it's what the data indicates to us. As a community, we have seen consistent investment now in rental assistance that's coming both from the government and the private sector, and that the government at multiple sort of jurisdictions. We know that that is a substantial problem, and that problem is going to exist for as long as we have economic and health conditions that are preventing a lot of people from being able to go into work and earn wages and therefore pay their rent.
I have a quick question, just kind of following up on what you were just saying there. With the data that hasn't already been published, is there any kind of indicator or predictions that you guys can see as a glimpse as to how much worse homelessness can get due to this coronavirus as you guys kind of head into that next count in the winter time? Or have those numbers kind of shown you guys anything where you're like, this is going to be really bad? I don't know if you guys can elaborate on that anymore.
No data, as you're saying, that we have in any sort of comprehensive way. The other part of your question is indicators, though. We do have indicators before COVID and then after COVID that we already had a lot of folks, again, who were experiencing homelessness for the first time or who were rent burdened. So that data is there. We do also just know that I think the recent statistics were unemployment levels that have not been seen literally in the last 100 years since the Great Depression. And so I think that's an indicator. And then we don't really, and then knowing that evictions have been suspended as a formal matter in most cases, and that people may not have been able to earn as they were before, and that housing prices and costs remain relatively high in this region. We have a lot of indicators there. You can see at the county, there have been a lot of interventions that we are beginning to craft to try to get at eviction prevention, either through supplementing the ability to pay rent, or some targeted investments to small businesses. But the indicators are there that if we don't have continued social services supports and the underlying economic conditions do not change quickly, we would expect that this would really put a lot more people at risk of homelessness over time.
I forgot to ask about, we did talk some about race, but Leo, I don't know if you, or I see COLLEEN is on the call as well, want to address what I'm seeing as a rise from 10 to 15% in Indigenous homelessness and a drop from 32% to 25% in Black or African American homelessness. Is that, is that also borne out in HMIS?
So I'll ask Christina to jump in with some of the specific HMIS numbers here in a moment. I will say that even within the fluctuations that you're describing there, Scott, all of it is shockingly disproportionate, and you're not implying that it's not. But whether Black African Americans who make up less than 10% of the county population overall represent 25 or 40% of the persons experiencing homelessness, all of that is unacceptable. And so that is certainly a starting place for us. And I don't think we're going to fixate on the fluctuation year to year of whether it is 40% versus 25% or 30%. What we are going to see is that is unacceptably disproportionate. And we need to react to that and attempt to cure that. And certainly that's the same case with Indigenous members of our community. The other group where we just have sort of consistently and the most severe disproportionality. Christina, I don't know if there's anything that you'd like to say on the data, and then we are joined by members of the Continuum of Care Board, one of whom is COLLEEN ECHOHAWK, who's also the Executive Director of the Chief Seattle Club, and certainly COLLEEN, if there's something that you wanted to say, I'd welcome that.
Yeah, I'll just add really quickly, HMIS we see the same disproportionalities that Leo mentioned and that the point in time count bears out. But however, the proportions don't change very much year to year. If we go back over the last couple of years, and all of this is found on our public dashboards, the proportions for each population fluctuate by plus or minus 1% per year. So we're not seeing those huge swings, but we are seeing that same disproportionality.
Hi, everybody, and thanks, Scott, for the question. And Leo, thanks for letting me share a little bit. You know, I think part of what we're seeing is that we have really invigorated the Native community to get really involved in the point of time count. We've been vastly undercounted for years and years and years. And so we had 4 different Native agencies really working hard to make sure that our community was surveyed. So that's part of what we're seeing. As far as what's going on with HMIS, I think that our folks are really good of hiding out from HMIS. That's the other thing we're seeing. They are wary of government systems. We're working on that. We're trying to get them feeling more comfortable, and that's the importance of POC-led organizations, because we know our community, we can provide them that place of comfort and security so that they can get into systems like HMIS. So I will say that I was very disheartened when I saw the numbers, because we have worked so hard. The county's been so supportive, the city's been so supportive, and we're trying really hard to change the trajectory of our relatives who are experiencing homelessness. So it's been yesterday was a little bit of a shock, and but we have to just keep working. So thanks, Scott.
I have a quick question about the hotel or the motel in Kent. And I don't know if any of you can speak to this, but I've heard that it's being, the isolation and quarantine motel is being held open and kept, quote unquote, warm in case it's needed as an isolation site. Is there any discussion of using that as a temporary or more permanent shelter for people experiencing homelessness?
I think that's Erica. Thank you, Erica. The Kent facility in particular, you are correct, the county did purchase the facility under public health emergency powers, was able to put it into use back on March 10th to begin to provide isolation and quarantine services. We now have 3 active isolation and quarantine facilities that are operating across the county. So that is the facility in Kent that we're talking about, one in ECHOHAWK that has been operating, and then one in North Seattle that's operating as well. We have a 4th isolation and quarantine facility that could be put into service in White Center. What we are watching right now is the number of persons who have been using those services versus the overall capacity, and then trying to both be ready so that we can provide services to anybody who needs it. And we've now served hundreds of people in our isolation and quarantine system over the last 4 months. And in our analysis, what that really means is that a person who was either infectious or potentially infectious was not sleeping in a congregate setting like a shelter, or sleeping in a home with a person who was vulnerable, and instead they were able to receive a safe place to be by themselves while they figured out what was going on with their diagnosis and then complete a course of recovery. With Kent specifically, as we've been taking a look at overall usage so far, and are also mindful always of being good stewards of public resources, we do believe that current usage justifies that we would consolidate operations into 2 isolation and quarantine facilities. And so we've identified the Kent facility as going, as you had mentioned, quote unquote, warm. In other words, that we are not referring guests to it right now or staffing it, but that we would be able to put it back into action on 72 hours notice. We are not closing that facility, and we are also not changing its use because the facility was put into action under a public health rationale, and cities have a role in permitting and in regulating types of facilities that are within their boundaries, particularly when we are not in emergency situations. There's a number of sort of regulatory regimes that are governing what we might be able to do with particular facilities, and then also the importance of just strong partnership with cities as we take a look at what we have to do right now. We are focused on the fact that we do not think that we are through this COVID-19 emergency. We see numbers are beginning to escalate again, and we are seeing across the country that we are moving towards things that are beginning to look like second waves. And we certainly know in the fall that we need to be ready to provide larger numbers of isolation and quarantine rooms if they become necessary. So for those reasons, and then the fact that all we really are is one sort of large maintenance issue away at one of our other facilities from having to close it down. We really need to maintain the ability to transfer folks to another facility if necessary so that we can continue to provide that place where people can sleep safe and away from other folks. So no future discussions or plans right now for the Kent facility, other than the fact that I would guess that we will put it back into service as isolation and quarantine before this emergency is over, either because the numbers would increase to the point where we would need it, or that possibility that we might need to use it as an alternate isolation and quarantine facility should we have a maintenance issue at another one of our facilities.
Okay. If that is our last question, we will adjourn. I thank you all for joining us. And do look at regionalhomelesssystem.org for more information and to access the point-in-time count, past and present, and also our homeless dashboards. Thank you for joining us.